Hello everybody, my name is Erik Kovessy and this is my presentation for a summative evaluation of the cardiac unit for paramedics. So I wanted to start off my presentation by just discussing the learning objectives I've identified for this unit. The first learning objective is to have students to properly identify and correct different ECG rhythms. The second one is students will be able to diagnose patients' current condition based on their medications. So that's like if you arrive on scene and the patient's family hands over a bag of medications, we want students to be able to take those medications out and be able to figure out the patient's current conditions just based on the medications they're taking. Third one is students will be able to analyze different signs and symptoms to create a working diagnosis and treatment plan for acute cardiac conditions. So that's by looking at just the patient's condition, their chief complaints, their vital signs to try to figure out just what's going on with the patient. So the overview of my assessment is that we'll break up the assessment into 4 different parts. The first one will be a presentation. The second one will be a multiple choice exam, which will be followed by a practical scenario, and we'll finish just with an interview after the scenario is completed. So for the presentation, what I would like to happen is for students to go off and research any cardiovascular disease they want. By having students go off and be able to choose whatever disease they feel is interesting, hopefully they'll feel more engaged in this assignment. So once they've chosen their disease, they'll prepare a presentation for about 10 to 15 minutes, and that will be followed up by questions from the class. For the evaluation of this presentation, I wanted to bring in the concept of having peer evaluation. So I would have all my students design a different rubric and bring it in to the class prior to all the presentations, and then there would be a discussion on which rubric they feel would be the most appropriate. And just as a backup, in case the students didn't bring any appropriate rubrics, the instructor would have a backup to use. And then the rubric would be able to be given out to all the students before they present, so that way they would know what's expected of them. And then after the presentation, all the students would fill out an evaluation on their classmates' presentation. So the second phase of my assessment would be a multiple choice test. Now I know that going through this course that we've learned that multiple choice tests are kind of considered out of fashion. However, I don't think it's fair to completely remove these from the assessment process, since there are many students that do excel in this kind of assessment, and to take that away from them and force them just to do different types of assessments wouldn't be fair to them. A multiple choice test can still be considered an authentic assessment, as it is preparation for the paramedic certification exam, the AMCA test. Since the AMCA test is made up of just multiple choice questions, having students learn how to write these kinds of tests will help them with their certification. So for my multiple choice test, I would ask more practical questions that are essential rather than familiar questions. I think we've all gone through multiple choice tests where you get asked questions and then afterwards you think, when am I ever going to need this knowledge? So the questions I've designed in my multiple choice tests are based on more the knowledge that paramedics will need in their day-to-day lives. When I designed these multiple choice questions, I tried to use the higher levels of thinking on Bloom's taxonomy. So things like, what is the relationship between, how else would you, and other things like that. The other good thing about multiple choice tests is they're quick to mark, so it does provide students with feedback in just a simple day or two, if not immediately. And then I've also included my sample multiple choice test. It's just in a separate Word document that you guys can check out just at the end of this presentation. So the third phase of the assessment is a practical scenario. So before going into the scenario, students will be given just this information here. So you are called to the scene of a 70-year-old male whose wife stated that the patient was complaining of chest pain and then passed out. The patient is currently on the floor unresponsive. He is pale, cool, and diaphoretic. The wife hands you a bag of medications which include Ramipril, Crestor, Lasix, ASA, Metformin, and Altroxin. She states he has no allergies and then provides you with a health card. The student would then go into the scenario and perform the scenario. So during our scenario, we'll have a sim man used. What the sim man is basically just a dummy that can be programmed remotely from a separate room to mimic different breathing patterns, different vital signs, and different ECG rhythms. You can even have a voiceover used with the sim man. So why it's valuable in this scenario is it doesn't require the instructor to be in the room. So hopefully this will help relieve a bit of the stress on the student because they won't have the instructor right over their head breathing on them as they're trying to perform a scenario. And in addition, we'll have the whole scenario video recorded. So again, it'll help decrease the stress of the student because the instructor won't be in the room. In addition to that, with it being recorded, it can also be used for review later on if the student felt that they've received an unfair mark and the instructor may miss something. They can just ask to review the whole scenario with the instructor, or the instructor can use it for feedback as well if they want to show the student where they can improve. So during the scenario, they'll have a normal paramedic partner as well in them who can do the task of a normal partner like vitals, cardiac monitor, and all those things. And again, this helps to mimic more of a real-life scenario compared to the way scenarios are run right now. Right now, the way scenarios are run, the one student who's being assessed has to pretty much do everything, verbalize everything. So that adds on a lot of extra stress when they're trying to take a blood pressure, obtain patient history, and they have 1,000 things going on at once. And we'll use an analytical rubric, which will be shown on the next slide. So here's a rubric I want to use for the practical scenario. So as we go through, it's all just the main things that need to be hit. This can be provided to the students beforehand because it doesn't say exactly what will be going on in the scenario. It will just say proper invention of the first arrhythmia, and then there'll be a second arrhythmia. So it doesn't say what those will be. So this way the students will know what's expected of them without giving away all the information of the scenario. So the arrhythmias can change from student to student to prevent cheating. So one student may go in and have a symptomatic bradycardic rhythm, which is just a very slow rhythm, which requires one type of treatment, and then their second one may be a patient with ventricular tachycardia with a pulse. And then those can be easily swapped out because there's at least 20 or more different cardiac arrhythmias. So we're going to give out 2 arrhythmias per student, so that way it gives them a wider chance to show their knowledge compared to just one. Students may walk in and really struggle with one arrhythmia but then really nail the second one. So as in comparison just to doing one and having the student really struggle with the one, it gives them a chance to help redeem themselves if they are having difficulties. So immediately after the scenario there'll be an interview just to ask a couple of questions. So the first question would be, just based on the medication, what history would you suspect the patient had? Which just matches up with one of the objectives I stated at the start of the presentation. And then the next question would be, what was the first cardiac arrhythmia you corrected, just to help them identify the rhythm. And what was your rationale for the treatment you provided? So when you're working as a paramedic, things aren't always black and white. There are some gray areas. So this way, if the student did something that wasn't exactly expected by the instructor, that it gives the student just a chance to be able to justify and rationale what they did and why they feel it was right. And then we'll just repeat that for the second arrhythmia as well. And then we just finished with, was there anything else you would have liked to do in this scenario? Again, scenarios are a very, very stressful experience for students. Sometimes students get flustered, and as soon as the scenario ends, they're just like, oh, why didn't I do such and such? So this will give them a chance just to show the instructor that they were thinking of it, they just really slipped their mind in this stressful situation. So that pretty much sums up my 4 different types of assessment. So I just wanted to quickly talk about why I feel they're all reliable, valid, and fair types of assessment. So the reason I feel they're reliable is they attempt to test students in a variety of ways. So by having the multiple choice test, just their own little research assignment on a cardiac disease, the practical scenario, and the interview after, it gives all students a chance to excel in their type of assessment. And as I mentioned before, it gives the students 2 different types of arrhythmias, so that way if they struggle with one, they can still have a chance to excel in the other one. and we tried to remove as many stressors as possible, so that way if they were to take the test another day, it would be under the same environments, and hopefully they would do just as well on if the test was given on Monday or if the test was given on Wednesday. So why the test is valid? The multiple choice exam was to help to mimic the AMCA, their certification exam questions, so it is useful for them. Scenarios, we tried to make them mimic the real world work environment rather than what's currently being used in colleges right now. And why I think it's fair is we have the students created their own rubrics in their presentation assignment. The multiple choice exams are marked quickly, so that way instructors can provide feedback for the practical scenarios and the interview afterwards, and plus if students can then bring up any concerns they have. And the scenarios are recorded, so like I mentioned before, if students have any concerns, they felt that they did do something and the instructor said they didn't, then they can just call up the recording and go through it together. And just my final thoughts, that I think it is both assessment of learning and assessment for learning. So why it's assessment of learning? It does provide assessment in a variety of different formats. It ensures students are ready to move on to the next phase of learning. And why it's assessment for learning is the feedback, it provides feedback for the instructor's learning techniques, obviously. So if all the students fail the multiple choice exam, then they need to revisit their teaching strategies to find out how they can improve this for next time, or what they need to review with the students so they can move on to the next level of learning. It prepares students for their certification exam, and it also prepares them for just the job testing scenarios as well. And it also helps students identify their strengths and weaknesses. So that's my whole presentation, so I hope you enjoyed it. And if you have any questions or comments, you can just ask them following this presentation. Thank you very much for listening.